Hi guys, I'm back. My name is Aliabadi. I'm one of the gynecologists in the city of Los Angeles. Today I'm here with my patient Sheila, and I'm going to teach you everything you need to know about hysterectomies. So there are three different types of hysterectomies. You can have a vaginal hysterectomy, abdominal hysterectomy, or a laparoscopic hysterectomy. With a vaginal hysterectomy, the uterus is removed through the vagina. So it's a vaginal approach, and we remove the uterus through the vagina. This type of procedure has a very short downtime, and patients tend to go home the same day, and they don't have any abdominal incisions. This option is only available to patients that have a smaller size uterus. The second and the most common type of hysterectomy is an open hysterectomy. In open hysterectomies, patients have an abdominal incision, whether it's vertical or horizontal, and the uterus is removed through the incision. The third type is a laparoscopic hysterectomy. With laparoscopic hysterectomy, we make small incisions measuring 5 millimeters to maybe 1.5 centimeters, and we remove the uterus through these small incisions. We operate using a laparoscope, which is a camera that we insert inside patient's abdomen, and we're able to remove the uterus through these small incisions. How are you doing, Sheila?
I feel amazing. I'm doing great. So it all started about 3 years ago. I've been dieting, I've been walking, trying to lose weight. So I went to my primary care doctor because I was having so much bloating and pain, and I noticed that no matter how much I dieted and watched what I ate, my stomach continued to grow. So I went to a couple of other surgeons, and they kept telling me that I have to have an open procedure and I have to be in a hospital for days, and I'll need to be home recuperating for 6 weeks. I work in a busy professional setting, and being down that long was just not doable for me. So I came across a friend, and she told me about you, and she said that you may be able to do an outpatient procedure on me. Although I was a little hesitant because my stomach was so big, so I feel the fibroid might be too big for outpatient, but thank God I found you.
The open incision that Sheila is referring to is when patients get scheduled in the hospital as an inpatient surgery, and they get an abdominal incision, whether it's like a C-section scar or a vertical incision. That's how the uterus is removed. Patients with a very large uterus, the size of Sheila's, which was about a 23-week size pregnancy, to put that in perspective for you guys, is just like someone walking around with a 5.5-month pregnancy every single day. So for those of you who've been pregnant, you remember at 5.5 months, it's not easy because you have back pain, you have to go to the bathroom regularly. The only difference with Sheila is that she used to have heavy periods and crampy, painful periods on top of everything else. Almost every patient in Sheila's situation end up having open hysterectomies. Over the years, we've tried to do more and more of these hysterectomies laparoscopically, and these patients used to stay 1 night instead of 3-4 nights in the hospital. What I've started to do in the past couple of years is actually completely bypass the hospital and do these procedures as an outpatient. So with the outpatient surgery, the patient shows up to the outpatient surgery center in the morning, and we do this procedure through 4 little 5 millimeter incisions. One of the incisions is about 1 inch in length, and that's the incision we use to basically remove the uterus. So the first part of the procedure, we release the uterus inside the abdomen using our laparoscopic instruments. Once the uterus is completely released, I use a bag, imagine a Ziploc bag, and I push this bag through one of the bigger incisions into the abdominal cavity, and with my assistant's help, we put your uterus into this bag, and then we bring this bag to the incision. We continue pulling small pieces of this uterus out of this bag until the entire specimen comes out.
So wait a minute. So you had a bag inside of me?
Yes, a Ziploc bag.
Oh, wow.
I'm just kidding. It's not an actual Ziploc bag, but it looks like a Ziploc bag, but it does the job.
Wow.
Your surgery, I think, took about an hour and a half. The first half hour takes for the actual hysterectomy to release the uterus. The toughest part of the procedure is actually to remove a mass this big from an incision that's only an inch. So I think I spent most of the time pulling the specimen out and not really doing your hysterectomy. But how did you feel afterwards?
You know, when I came to from the anesthesia, I felt like I never even had surgery. You know, I didn't feel any pain. That was so weird because I was expecting to be in so much pain and could barely walk. So I was in no pain at all, that even when I was discharged, that I walked out. I didn't even want to get in a wheelchair.
That's not the norm. Most patients get into the wheelchair, but go ahead.
But the amazing part to me was like when I did get home and, you know, I got comfortable, and the nurse kept telling me prior, make sure you take your pain medication. But like, I didn't need it. I did not need any pain medication at all, which was amazing to me. I did take one Motrin, only for soreness, but other than that, that was the last time I took anything. And I feel amazing.
That's amazing.
And the best part about it also to me was that 3 days later, believe it or not, I was able to drive and I walked 4.5 miles.
This is crazy. This is the first time I've heard this.
I know, but you know, it's like it was the best surgery in the world, and I am so glad that I did do it laparoscopically with you.
Oh, you're so sweet. I'm glad you're doing so well. You look great. You don't look so pregnant anymore. This segment is so important to me because hysterectomies are the most common procedures done in this country. And it's so important for patients to know that there is an outpatient, laparoscopic, minimally invasive choice available to them. So if you have a fibroid uterus, or if you, for whatever reason, you need to have a hysterectomy, make sure you find an option that's more minimally invasive and doesn't require the big downtime that's associated with vertical open incisions. Until next time, I hope you enjoyed this segment. Sheila, thank you so much for joining me.
Thank you.
And I'll see you later.